Diabetes is a chronic condition that affects millions of people around the world, including over 11 million Canadians. This number is expected to rise to 14 million by 2026, meaning that 3 million Canadians may require insulin at some point in their lives. In Canada, the cost of insulin has risen by over 50% in recent years, with prices ranging from $30 to $40 per vial in 2019 to $69 per vial in 2021. This increase in cost is due to rising demand, not just in Canada, but also from the United States, where insulin costs up to $350 per vial. While many Canadians turn to health insurance policies to lessen the cost of insulin, treating diabetes also requires other medical products such as syringes, alcohol swabs, insulin pumps, glucose monitors, and test strips, which can add up to a monthly expense of up to $1,500. 90% of Canadians with diabetes have type 2 diabetes, which is typically diagnosed later in life. Type 1 diabetes, on the other hand, is found earlier in life and is caused by the body's inability to produce enough insulin. Although stress alone cannot cause diabetes, high levels of stress can cause pancreatic cells to slow insulin production, leading to high glucose levels and the development of type 2 diabetes. Stress can also increase the risk of developing diabetes indirectly by causing individuals to increase their food intake. The pandemic has also led to an increased risk of diabetes, particularly for those with pre-existing diabetes, who are at higher risk for developing health complications from COVID-19. While diabetes continues to be a major health challenge, learning to control stress can help individuals manage their glucose levels and reduce the risk of developing diabetes. The future of diabetes treatment. While the current situation surrounding insulin costs and diabetes is concerning, there is hope for the future. Researchers are looking at alternative methods of insulin delivery, such as inhalable insulin, which could potentially lower costs. Additionally, there is a push for government intervention to regulate insulin prices, as seen in the United States with the recent introduction of a bill to cap insulin costs. There are also advancements being made in diabetes prevention and management, such as improved lifestyle interventions and monitoring technology. However, it's important to note that progress in the field of diabetes treatment and prevention requires funding and research. This is why it's crucial to raise awareness about the issue and advocate for more resources to be directed towards diabetes research and care. In conclusion, the rising cost of insulin in Canada is a concerning issue, particularly for the millions of Canadians living with diabetes or prediabetes. The demand for insulin, both in Canada and the United States, has driven up the cost, making it difficult for patients to afford this essential medication. While there are currently no easy solutions, there is hope for the future through alternative insulin delivery methods, government intervention, and advancements in diabetes prevention and management. But this requires continued research and funding. It's important for individuals to be aware of the cost of insulin and diabetes-related expenses, and to advocate for more resources to be directed towards diabetes research and care. Together, we can work towards a future where diabetes is better managed and more affordable for all those who require insulin.